The Trans-Allegheny Lunatic Asylum, also known as the Weston State Hospital, is a historic psychiatric hospital in Weston, West Virginia. It has a long, dark history that involves deaths and murders and medical experiments and so much more. So I'm going to give you a timeline of events for the hospital. I'm going to start like when they first started building it to what is going on with the building today. I am not going to talk about everything that has ever happened at the hospital. That would take me days and days, but I am going to touch on like specific time periods and tell a couple stories of things or events that happened at the hospital. So let's dive into the timeline of the Trans-Allegheny Lunatic Asylum. Construction began on the building in 1858. The asylum was designed following the Kirkbride Plan, which was named after Thomas Story Kirkbride, the superintendent of the Pennsylvania Hospital for the Insane. And the design was meant to incorporate light and fresh air and nature into the building. And they felt like doing that would really help those who were sick get better faster and give them a better environment to be able to work on whatever issues they were dealing with. In the design of the building, doorways were positioned so that light would just flood through them. There were open spaces for patients to gather and socialize. And the way the building was laid out, if you looked out, it looked like you were looking out into like a meadow, rolling hills, beautiful green gardens. And Kirkbride felt like something like this was what was needed to help people get better. This building's primary structure was made of hand-cut stone. And when you see how big the building is, it's crazy to think that that was hand-cut stone that built that building. In 1861, though, the construction on the building would halt because of the Civil War. So construction would be interrupted during the American Civil War. The government of Virginia demanded that the hospital return its unused construction funds for defense of the South. But before this could occur, before the South could take the money back, the 7th Ohio Volunteer Infantry seized the money from a local bank, delivering it to Wheeling. So that money would be put towards the establishment of the reorganized government of Virginia, which would side with the North, which would later become the state of West Virginia. And this reorganized government would make sure that the money would go back to the hospital so construction could resume in 1862. In 1864, the asylum would officially open. It would open its doors to patients, even though it was still under construction. It was originally intended to hold 250 patients, and the facility aimed to provide a humane and modern environment for individuals suffering with mental illnesses. Its first patients were 9 women. By 1880, the hospital that was originally designed to hold 250 patients held 717, and it was only going to get worse from there. Finally, in 1881, construction would be completed on the hospital. By the time the facility was officially completed, it was one of the largest hand-cut stone structures in the world. By this time, the asylum was rapidly growing because the population was in need of more mental health services. But at the end of construction, the hospital was kind of very self-sufficient. It had a farm, it had a dairy, it had a waterworks, there were gardens, it had its own cemetery. So the people at the hospital never needed to leave the hospital grounds, but it gave them also opportunities to maybe have jobs, to be able to be outside, to be able to be productive while they were at the hospital receiving treatment. Between the 1930s and the 1950s, a lot of things are going to happen at the hospital. During the 1930s, the hospital housed 1,600 patients. Remember, this hospital was built for 250 patients. Don't let the size of the building fool you. The hospital was not built for that many patients. It was built for a low number of patients to receive one-on-one care with doctors and nurses to be able to get better. But when you put 1,600, and it's going to end up being more, patients in a hospital that was built for 250, things aren't going to work right. Because of the overcrowding, the hospital conditions began to deteriorate, and they started adopting more controversial methods of treatment, including electroshock therapy, lobotomies, and other experimental procedures. So let's talk about the lobotomies for a minute, because that's kind of one of the things that the Trans-Allegheny Lunatic Asylum is most known for. Lobotomies were regularly used to treat mental disorders because they interrupted the neural connections in the brain's prefrontal cortex. So the patients at the asylum underwent what were called transorbital lobotomies, which is also known as an ice pick lobotomy. So this involves the insertion of an ice pick-like instrument into the eye socket until it connects to the brain tissue. So Dr. Walter Freeman really popularized using lobotomies, and he is actually who brought it to the Trans-Allegheny Lunatic Asylum, where he started performing lobotomies for $25 a patient. When he would do these lobotomies, he actually encouraged people to come watch, and he used it as like a theatrical presentation. While the hospital was open, they performed over 4,000 lobotomies, which left patients with irreversible brain damage and brain hemorrhages. By the 1950s, the patient population at the asylum peaked to over 2,400. Remember, it was built to hold 250 people, 2,400 by the 1950s. And the asylum just really started being known for its inhumane treatment of patients due to the lack of staffing. At the height of its peak of how many people were in there with the 2,400, the patient to doctor ratio was sometimes 248 to 1. That means one doctor for every 248 patients. The whole hospital was only supposed to hold 250. The plan that Kirkbride had, in reality, was a pretty good plan, but it did not stay the way it was supposed to and quickly devolved into what it became. Because of the lack of adequate supervision, there were instances of violent outbursts, there was abuse, there was suicide, there were even murders that happened at the asylum. Both the patients and the staff were susceptible to these horrific acts, especially the female staff who were having to deal with these aggressive, sometimes actually not even mentally, but criminally insane people at the hospital, and there was no extra staff there to help them. There's one instance of a nurse who was murdered by an unknown patient whose body was found at the bottom of an unused stairwell 2 months after she disappeared. By the end of the 1950s and the early 1960s, there were a lot of calls for reform on the hospital. As public awareness of mental health care issues grew, reforms were really being called for across the country. The introduction of new psychiatric medicines and mental health treatments started, and this led gradually to the decline of the number of patients being held at the asylum. By the 1980s, the asylum had reduced its population due to changes in mental health treatment. In February of 1986, the then Governor Arch Moore planned to build a new psychiatric facility elsewhere in the state, and he wanted to convert the Weston Hospital into a prison. So Moore had authorized the work to begin on this prison conversion, but the state found it to be unconstitutional, and the work to take the hospital, the asylum, to a prison was halted. Finally, in 1994, the asylum would close. So after decades of overcrowding, deteriorating conditions, and a nationwide push towards deinstitutionalization, the asylum was permanently closed in 1994, and patients were either released or transferred to other facilities. So fast forwarding to 2007, so the hospital was bought, and they started doing preservation on it. And in 2007, the Trans-Allegheny Lunatic Asylum was reopened as a museum and a historical site. It started offering tours, including historical tours and paranormal tours, which drew visitors who were interested not only in the history side, but in like the ghostly, scary, spooky side of the hospital. Today, the hospital, the Trans-Allegheny Lunatic Asylum, is still there. It is still doing tours, and it is a very popular tourist attraction in West Virginia. The asylum is known both for its historical significance in the evolution of mental health care in the United States and its reputation for paranormal activity. The facility has been featured in numerous documentaries and TV shows about haunted locations. TV shows such as Expedition X with Josh Gates, Sci-Fi's Ghost Hunters, you have the Travel Channel's Ghost Adventures, you've had numerous like YouTubers and bloggers go and do like the paranormal tours and try to find ghosts and spirits in the asylum. The asylum still does tours like it did back in 2007 when it first opened. You have the historical tours, you have the paranormal tours, and it is a great way to see how the hospitals dealt with mental health back in the day. And it's also a cool way to see, like, is the hospital really haunted? Like, is on these paranormal tours, am I really going to find something? So what could put you in the hospital? In the 19th and early 20th centuries, there were numerous reasons why you could be put in the state hospital, the state mental institution. And some of them made sense and some of them were absolutely ridiculous. So some of the more logical reasons you could be put into the lunatic asylum were things like mental illnesses, schizophrenia, severe depression, anxiety disorders, uncontrollable bipolar disorders, were legitimate causes to be institutionalized back then. Another reason you could be put in the hospital was because of seizure disorders. So seizure disorders were often misunderstood as mental illnesses, and individuals with something like epilepsy were frequently confused as someone who was mentally ill. You could be put into the insane asylum for dementia or old age. Elderly individuals with dementia or other age-related mental decline were often placed in asylums due to the lack of alternative care options. And a lot of asylums did have like maybe a building off to the side. I know that the Trans-Allegheny Lunatic Asylum did for those elderly people to be in a different place than in the main hospital. So women suffering from postpartum depression, also known as hysteria, were sometimes institutionalized because there was so little known about women's mental health back then, especially after having a child. And the health issues were just so poorly misunderstood and often dismissed that they thought the women were just crazy and would put them in mental institutions. They would also put people with intellectual disabilities into the asylum because there were really very few resources to help mentally disabled people, and they did not know what to do with these people, so they put them in the asylum so someone else would take care of them. A lot of the reasons people went to the asylum were a reflection of the limited medical knowledge of the time. But there were also some really crazy reasons you could be put into the asylum, and I'm going to show you a chart. I'm not going to go over everything, and these are reasons for admission between 1864 and 1889. I'm going to touch on a couple of them, and I'll just let you read the list. Asthma. You could be put in the asylum for asthma. The overstudy of religion. Domestic troubles. Kicked in the head by a horse. Woman troubles. And another one, desertion by your husband. So some of the reasons you would go to the asylum were modern day medical reasons. Some of the reasons you could go to the asylum, especially when it first opened, were absolutely ridiculously crazy reasons. So the Trans-Allegheny Lunatic Asylum is actually a complex of large buildings, and there's several buildings. You have, of course, the main building, and then you have other buildings. So I'm gonna talk about a couple of those. Of course, you have the main Kirkbride building, the big stone building that everybody knows, meant to be like a therapeutic place for people to be able to come and get help for their mental illnesses. But of course, we know that it became overcrowded, too many people, murders, abuse, harassment, all these things happened. But the Kirkbride building is the main building on the complex. Then you have the medical center building. So the medical center is where a lot of the medical treatments would happen, including the electroshocks and the lobotomies. You also have the forensic building, which was the maximum security building used to house the criminally insane patients or those that were deemed too violent to be with the regular population. So probably the most well-known murder that happened at the Trans-Allegheny Lunatic Asylum is going to involve three men, a guy named Dean, a guy named Big Jim, and a guy named David Mason. Big Jim and Mason were both murderers who were criminally insane and included in the asylum's top 10 most dangerous inmates. So according to the story, Big Jim and David Mason tried to hang Dean multiple times over the course of a few weeks, but it never worked. Well, one day, Dean's luck ran out. They forced Dean's head under a bedpost, and then they jumped up and down on the bed, killing him. It is said that Dean's spirit still lives in the building, in the main Kirkbride building. And people have said they have seen him, they have heard him crying, especially in the room where the murder happened. Sometimes people say they see the shadows of Big Jim and David coming around them like it wants to attack, like they want to attack them. So the room that this happened in, people have said that they feel physically ill when they enter that room. I'm not a big believer in ghosts, but I do believe that when something really bad happens in some place, that place can absorb that bad energy. The Trans-Allegheny Lunatic Asylum stands as a powerful symbol of the history of mental health care in the United States. It both reflects the aspirations to help people, but it also reflects the failings of early psychiatric treatment. I personally got to visit the Trans-Allegheny Lunatic Asylum probably about 12 years ago, and you don't realize how big that main Kirkbride building is until you are there and you see it and you go into it. And it is amazing. And we did both a historical tour and a paranormal tour. I would encourage anyone, especially if you're in the West Virginia area, Ohio, Kentucky, Virginia, to take a trip to see this place because it is absolutely amazing.